wondered, are these blood pressure medicines making me feel worse? You're not alone. One of my subscribers shared that she's been dealing with hair loss, fatigue, and sluggishness after starting blood pressure medication. As a physician, I was trained to prescribe medications that cause many side effects. Today, let's discuss how to safely reduce or even get off your blood pressure medications with a plan. First, let's talk about what you're feeling. Some blood pressure medications like beta blockers and fluid pills can cause side effects, including hair loss due to nutrient depletion or hormonal shifts, fatigue or low energy, brain fog, and sluggishness. You are not imagining this. These are real documented side effects. And it's okay to ask, is there a better way? Medication isn't the only path. As a doctor, I now realize that our training has been heavily medication focused. This is largely in part because of the research of anatomy, physiology, and pharmacology. Most medications are designed in theory to improve or inhibit other pathways at the cellular level of our organs to produce a desired result. However, those results do not come without significant side effects and potential damage to key organ functions. Once a medication is ingested or injected, then there is a cascade of events that happen in the body. Every person reacts to a medication in a different way, ranging from mild to severe to life-threatening side effects. Research has always been done through clinical trials worldwide. So when someone talks about evidence-based information, then it simply means that there are supportive scientific background studies. In short, Western medical training does not include any alternative or naturally occurring plants, herbs, or supplements. Medical education is evolving, but has a long way to go. Like you, most things that I've discovered about alternative medications or treatments have been by doing my own research. But there are so many things to take into consideration before committing to any type of remedy, whether manufactured or natural. Strategy and treatment plans have to be individualized in order to get the best outcome a person wants to achieve. There are 6 natural evidence-based strategies to reduce your blood pressure and are foundations for your overall wellness. I talk about these frequently as key building blocks. Each of these elements can be designed to fit any health and wellness plan at any age. Number 1 would be the DASH diet, or dietary approaches to stop hypertension diet. There are also other versions of this diet which can also include something called the Mediterranean diet. Basically, these diets are high in fiber, high in veggies and protein, low in salt. We talk about reduced intake of processed foods and also good hydration. Number 2, sodium reduction. As a rule of thumb, sodium levels need to be kept between 1,500 and 2,300 milligrams per day. This is specifically important for Black patients. I will have a special segment as to why this is in another video. Number 3, potassium-rich foods. Those examples include bananas, orange juice, sweet potatoes, and spinach, which all help to balance sodium. This is a very important step into balancing the electrolytes so that your cells can actually work well in the organs. Number 4, daily movement. At least 30 minutes of walking per day lowers your blood pressure at least 5 to 10 points. Number 5, weight loss. Even 5 to 10% weight loss can actually lower the blood pressure. And number 6, stress management. Whether through deep breathing, prayer, yoga, journaling, therapy, alone, and or in combination can improve your emotional, mental, and spiritual wellness. I remember a patient who came in exhausted. She said, "I think my meds are hurting me more than they are helping." She began to discuss what she was experiencing. She was tired all the time, wasn't sleeping well, and not being able to concentrate on simple tasks. I asked her a series of questions related to her family and work life. I could honestly say that I didn't have an answer, other than trying to wean her off medications with the idea of starting another one. At that point, I really felt like I failed her and hurt her in the process. She trusted me to have an answer. I actually told her that, and I apologized to her. I made it clear to her that this plan was experimental, hence what we call the practice of medicine, and reassured her that we would work together to help her to feel better. Over the course of several encounters, we did in fact work together, reviewing her symptoms, her blood work, and also discussing her self-care. We discovered an issue with her heart that needed a heart specialist referral. The team approach was created and she was hopeful, and gradually she's improving. It's not an overnight success story. It can be very stressful, frustrating, eye-opening, and rewarding all in the same time frame. But for me, it brought more awareness of the importance of effective communication, comprehension, and compassion, the same foundations of establishing any relationship. Honesty, trust, integrity, and transparency are priceless. If you are thinking that your blood pressure meds are making you feel worse, please do not stop your blood pressure medicines abruptly. Schedule an appointment with your doctor right away. You need a plan, support, and guidance from your doctor. Another option would be to join me inside my 7-day blood pressure reset program. I'll guide you step by step with meal plans, trackers, and the truth behind your numbers. No medical jargon, because you deserve to understand your body and feel your best. Click the link below to enroll or learn more. And if this video helped, don't forget to like, share, and subscribe to The Good Doctor's Perspective. Until next time, stay informed, stay empowered, and work with your healthcare team to achieve your wellness goals.